if you're here, please feel free to drop a comment and say hi. Let us know who you're here. Thanks, Ariana. We think it's a beautiful new space too. Okay. So Jackie's going to read some of the questions. She's going to give you a tour. We're going to get started and introduce all of ourselves and kind of go from there. Here comes Miss Tiffany to join us.
Hello. Hi.
All righty. So we're going to... Great. Hi, everyone. I'm Beth. I'm the director of Women's Healthcare of Illinois Nurse Midwife. This to my left is Tiffany.
Hello. How's everyone?
I'm Shauna. Hi.
And I'm Jackie. Hi.
And we are joining you tonight from the lobby of our brand new Evergreen Park office. Freshly remodeled, just opened, beautiful, bright, open, airy space with great views. And we're really excited to be able to share it with you. There are still a few patients coming in and out tonight, so we'll kind of change the angle as the night goes on. And some people will be dropping by later on for some live tours of the office, which we're really happy to show you. So please feel free to drop a message or a comment, ask a question. We'll be more than happy to go over that with you. But we thought we'd start by just giving you an introduction about each of us and our midwifery experience and Women's Healthcare of Illinois. We'll tell you a little bit about where we deliver and our philosophy of care. And then we'll take you on a tour of this beautiful office and kind of go from there. So would you like to start this year?
Sure, why not? Well, as you said, my name is Tiffany. I've been providing care for women for, for my age, almost 20 years from the perspective of labor and delivery, and then transitioned into an advanced practice nurse as a women's health nurse practitioner about 10 years ago, and then I became a midwife almost 2 years ago. So I joined this practice in January of 2019, so just over a year ago now, and time flies. It does fly when you're having fun, which is hard to believe already, and has been a joy being here, being a part of this with the team. So it's been wonderful being here, providing care, especially in the area where I grew up. So it's been a wonderful experience thus far. I'm looking forward to years to come. So, we're passing the baton to Jackie.
Oh, we should bring the baton out one of these.
My name is Jackie. I am a midwife here. I was a labor and delivery nurse for a few years before this, practicing in Illinois and in New York City, and then came back to the area. I also kind of grew up in the south suburbs of Chicago, and I'm super excited to work with these lovely ladies. I've been here since April of last year, so also a little bit over a year. It's been a while.
I'm Shauna. Hi. I've been a labor and delivery nurse / working in mother baby for the last 10 years, I guess. I started off, I grew up in central Illinois and then moved up to the Chicagoland area. Started working my nursing career, and I also started in the role of Jackie, midwife and nurse practitioner here at Women's Healthcare, and we've been having a blast ever since. So
Been a blast.
bringing lots of babies into this world.
Tiffany has a lot of
Shout outs.
groupies.
Oh, yes.
Yeah.
Lots of chip shout outs.
Let's see what's going on here. I'm closer here.
I'm reading the questions here.
Okay, perfect. I'm Beth. I've also been a nurse midwife for a ridiculous amount of time now. I too would show my age saying it. It's probably close to 25 years. I love being a nurse midwife. I love working here. I'm so happy to have all of these lovely ladies on my team and to be able to do all this fun work that we do with these great patients. We're waving at a new mom and baby that just walked in the office, which we're so excited we get to see.
We love when you bring us the baby.
We do. We love the
Care baby fixes.
We love to see all of that coming up. So we're so excited about being able to share this practice with you guys and tell you a little bit about what we do. We are partnered with Family First Medical Group at the this point as well, which is Dr. David Beckham and his two nurse practitioners, Anne and Marissa. They are fantastic. We have been with them for almost a year now, and it's going great. We enjoy them being able to do our pregnant care, see our babies, partner with us during this pandemic, and provide care to you guys. So we're super excited about all of that. So please feel free to send in some of your questions, and we'll talk a little bit about that. You want to read a couple of questions or give a couple of shout outs to people? And
Well, no questions quite yet. Tiana, Tiffany's daughter, says hello, so we have to give her a
I
shout
have to give a shout out to my baby. Love her.
Otherwise, hi to Tina, Rita, Erica, Teresa, Kelly, Christina, Ryan, Harry, Ariana, Robin, Tracy.
Robin's always so wonderful.
Robin's so amazing. He's up in there. Thanks for joining us and taking time out of your night tonight to come and spend some time with us. So we think we should probably tell you a little bit about where we deliver. We are a team of 4 nurse midwives with 4 physicians who work with us as well. Those 4 physicians back us up in all of our anything that we need assistance with the physicians from. They're there to help us with all of that. We are on staff at Advocate South Suburban and at Silver Cross Hospitals. Our physicians are also on staff at Advocate Price Medical Center. So we can pretty much take care of you in any neck of Chicago, the South Chicagoland suburbs. We provide care to women throughout their lifespan, not just during pregnancy. We will be able to provide care for you if we are, if you're a college-bound student or somebody who's just having some issues with the menstrual cycle, annual exams, physicals. We do prenatal care, birth control, full scope prenatal care, full scope birth control options, postmenopausal care. Throughout the whole lifespan, we're taking care of women. So we're really privileged that you let us be a part of your life for all of that. We each have a little niche that we love to do besides OB. We all love OB, but we all have something that we kind of do a little bit that we really love doing. So I'm super excited about doing college-bound physicals and working with the girls that are about to leave for school and be off on their own. It's kind of my jam. I love working with the young mothers. And I also do a lot of care of our postmenopausal babies. So those are kind of my areas that I really love.
My, I guess, other heart besides, like you said, midwifery and for moms and pregnancy would be the young population and talking to those patients before pregnancy and preventing that case for them. And then just another dear part for me is health disparities and talking to women about how to get healthier, not necessarily obesity, but other health disparities, especially for women of color, is definitely something that's a very, very deep dive. So something that's needed.
And when Tiff is talking about not necessarily weight management, but we do have weight management specialty. Dr. Kathy Slodaki, who works with us, is a certified weight management physician now, board certified. So she has a weight loss program that she can work with people on. So that's super exciting as well. I think that's about your passions, Shauna.
So my passions. I really enjoy talking about sexual health and also depression, anxiety, are kind of a passion for me as well. And I think that spans through all lifespans. I really like doing the well child visits. Maybe we don't do anything with exams, but we can talk about anxiety, depression in school, high school, and then sexual health is super important. I think you get like a brief glimpse of it with PE or your grade school, but as women, we have so many things that go wrong on so many different levels, and we don't talk about it. So I really enjoy getting to kind of get into those grimy events, because Jackie knows when it comes into like labor and delivery, 36 weeks. If I have you, I will start talking all about sexual health and how to get that baby out. And I'm pretty
Sure.
pointed. I'm pretty pointed about it. There's no gray face there. So we bring it all out and bring down the curtains and just kind of talk about everything that we need to talk about. So I'm very passionate.
Just take that phrase though. What is that baby in?
It gets that baby out, you know.
We're gonna make it.
We're PG. We're PG right now.
Whatever. We all know how you got into this situation.
We do. We do.
It's fine.
How about you,
I
Jackie?
don't know. After everyone talking, I have so many like, exciting things that I enjoy to do.
Yeah.
Like vaginitis issues, I love that. If you have a vaginal issue, I think that's great. So we can talk about that. No one likes to talk about that stuff. Like, don't wear underwear. Don't wear anyone every day.
Yeah.
Just, common things that we never
think about douching, Jackie.
Yeah.
Very good.
Yeah.
And other things, though, like I've had so many young women think that every time they come for a second exam, they're doing a pap smear. So I guess the pap smear is
Yeah.
I love training about sexual health, and which I can go to how pap smear. Yeah, this is what it does. This is what
Yeah.
birth control is. I've recently had so many patients be like, "Oh, that was such a comprehensive birth control education."
Yeah.
That I've never even known that there are two forms of birth control in terms of hormones.
Yeah.
So,
Yeah.
just to educate them. Overall, I guess it's really exciting.
Just getting the verbiage out there, like you said, like the spectrum exam, and getting that confused, like I had people say, I think my pap smear done in the ER, and I was like, you did what?
Yeah.
Yeah.
I had 4 pap smears.
Right.
Where? What?
Yeah.
It's because we had a spectrum inserted into it. That was it. So I think that clarified this morning exactly what's being done to you.
Right.
Also knowing that you speak up and you advocate for yourself, and just knowing that you have that communication is being able to provide and make informed decisions, and that shared decision making is also part of this. That was really, really important.
Exactly. I think that's a huge part of the philosophy that we all share and that we brought to the practice is informed decision making and informed consent. We are really passionate about making sure that that is something that all of our women have, including during the childbirth process. There's a lot of education that goes on throughout all of your visits, whether it's gynae care, whether it's well-woman care, whether it's sexual health care, whether it's pregnancy care throughout the whole time. That continues during labor and delivery. I think everybody on the team is really good at educating women about the choices during labor. It's not just this is what's happening. It's a decision about these are your options. This is what we can do and how to make that work best for everyone. So I think you guys do a great job of that in your communications. We do get questions all the time about what options for pain management we have. And so I think it's important for people to know that as midwives, we do a lot of labor support. We're with you the whole time that you're in
That
active
we don't
labor.
deliver you in the field.
No,
Will be delivered in a hospital.
I do
and
wear shoes.
Yes, you can have pain medication.
And we're not always Birkenstocks. The shoes
No.
that she wears either.
I'm not wearing Birkenstocks.
No, you're not. And our deliveries are all in a hospital. They are not home births. We do not do any home births, actually. But we are on staff at those 3 major hospitals right now. We're at Christ. Right. We're not at Christ, but the practice is at Christ. We are at Silver and at South South. And we do have options there of high tech. We have nitrous oxide available, we have hydrotherapy available, epidurals, narcotics, as well as high touch and massage and the traditional labor support techniques that we all provide too.
COVID, the nitrous, that not available at present.
It is currently not available,
But-
but we hope that it will be coming back soon. We are working with the hospital administration to determine when it is safe to bring that back. Obviously, COVID has changed a whole lot, and a whole lot about the way that we practice. So we are right now, you can see we are socially distanced, hence why we're not wearing masks, but we are wearing masks. We request that you bring a mask with you to the hospital. We request that you wear a mask here when you're in the office. We're promoting all the same safe
techniques. Please wash your hands. You'll see all throughout our office there are multiple hand sanitizing stations. Wear your mask. Do all the right things that we should be doing at this point. Jackie is one of our COVID queens at this point in time.
Yes.
She
Lots
has
of
been on
videos
the
with Dr. Beckman.
She's been on the front lines doing COVID testing. Would you like to tell me a little bit about what we offer in COVID testing, Jackie?
For sure. We have a few questions, so I'll answer them and then we'll head to the questions. So, our COVID testing has evolved a lot since the beginning, but we are happy to say that we do offer COVID testing for anyone and everyone, whether you are a current patient or not, a man or a child. We offer the rapid tests, but we also offer the send-off tests, and we offer the blood work and swab testing. So currently we see a ton of patients who have pre-op appointments that need to be tested before they go to the hospital, maybe for pre-operative procedure, surgery, or induction or a C-section. But there are also people who have recently traveled or were exposed to somebody, or maybe want to go visit a loved one who's at risk, and so they just want to make sure that they haven't been exposed and they don't have it. So any and all types of people are coming to both locations and being seen. Currently, we either set up a video visit with you ahead of time or speak to you at the visit, and it's still a drive-through visit for the most part, and you receive your results there or within a few days, and there's always a physician or nurse practitioner available to talk to you about your results, which is really great.
Most of our COVID results you get right then and there, so you can get a printout too that you can take with you. There are a few things that are sent out, but usually for sure.
A couple of questions. So just to go along with some things, one of the questions was, we offer home visits, so we don't do any home visits at home, no deliveries at home. But along with that, the question was, what is our support after delivery and breastfeeding? So we definitely promote that post-2 postpartum visit, and many of our patients can attest to if they're a first-time mom or a first-time breastfeeder. We usually bring them in at around a week postpartum, and they bring their little one with them and we help them breastfeed to really see what they're doing, so we can troubleshoot right there on the spot. I know I personally, if I can help them, send them to Shauna because she breastfed twins, so she can do anything.
Yeah. And Shauna's the queen of telehealth visits
Oh,
too.
yeah. I was just gonna
So,
say back on the home visit. I'm sorry to cut you off, but
we
we
do
do the televisits. So for some patients who may be reluctant to come in because of COVID or because they can't because of childcare issues or whatever the case may be,
Right.
you have that option to do a televisit.
And even those breastfeeding visits too, if you don't necessarily want to come in or bring your baby with you, we can try to finagle it through a live visit, which is for the most part okay. It teaches me to be a little bit more hands-off than I am when you're here in my presence. But we can also finagle that as well and try to get it in.
For sure. I remember you did a video visit on someone who thought they had mastitis.
I did.
Showed you their breasts.
I
So
did.
Yep.
all things are possible.
We have done plenty of those.
Yep.
And we're learning and adapting. We can always bring you in if it's not successful when we start with a video visit. And we can make accommodations so that you're maybe the first person seen in the office or the last person seen in the office. That's the beauty of having 2 offices and having the long office hours that we have. With so many providers, we have somebody in the office usually from 7:30 in the morning all the way to 7 o'clock at night. And we
We
have
never
Saturday office hours as well.
The babies
we don't have
nights.
families.
We just
No, we
live
don't
here
go home.
actually. They just built a back area where there's bedrooms and we just sleep there. Never knew.
There's definitely a kitchen and stuff too. For sure.
I think another thing that's really important that I tell a lot of my moms, and it goes all the way through pregnancy too, is we set up minimum visits for you. Where like we want to see you every 4 weeks or every 2 weeks or every week. And then postpartum, we give you 2 visits, but that's not all we want to see you. So if you have issues, you're welcome to come in more than that, and that's included in your global package. So like, let's say you get out of the hospital today and tomorrow you're in tears. We want you to come in and not be crying, and I will work with you breastfeed. Or, any of us will do that, right? So
You
like,
can come
as
3
much-
times in the week postpartum.
Correct.
Right.
I mean, I hate to say you can come every day if you want, but we will see you every day if you want to come in and see us every day. We will squeeze you in somehow.
And We appreciate phone calls. I mean,
Yes.
we want to hear from you. One of us has the phones every single night. So
Here,
we-
I'm all cool now.
Ask Tiana how often my phone goes off.
please feel free to, give us a call. We're happy to answer your questions. We'd rather you call 100 times. And all of them, turn out to be nothing and be something that we can easily answer, then have you not call and have it be something that we wish you would have called for. Most definitely. Any other questions about it?
Another question was, do we test all patients before they go into labor? At this point, it's mostly hospital based, but at every hospital that we deliver at tests every patient who comes into labor. So we will test people at our own office if there's a scheduled induction or C-section, but anything unscheduled, obviously, we don't know when it's going to happen. So once you get to the hospital, they will test you. And then someone else asked if we had taken care of any COVID positive patients, and we have. I don't know if the midwives have delivered any. I haven't personally.
Yeah,
I have not.
We've had one. We've had a handful of COVID positive moms who have all done very well and who have been COVID positive during different points in their pregnancy, whether it was, second trimester or whether it was at the time of delivery. But moms and babies have done very well at this point.
And then to continue on that, someone asked that they are going back to work as a teacher and what do you recommend. I think we've also been really fortunate that a lot of moms haven't tested positive, maybe are asymptomatic, or the moms that we've had who are just about going into labor. So I think we would recommend all the things we normally recommend with coronavirus, which is wear a mask, wash your hands, don't hug people, don't be around large groups of people. Right. Don't
Wear your mask properly, not under your nose,
Right.
not
And if you-
over your mouth.
You have to do what works for you. Like, you had a patient who had a baby shower recently, and she was like, "What do you think about that?" And I said, "Well, I mean, you have to do what makes you feel comfortable, but maybe you go to your baby shower and you wear a mask, or you don't have anybody. And if people think that's weird or rude, too bad, so sad. I mean, you have to do what you feel comfortable doing, but also you can be cautious.
And obviously, this is a big topic of discussion. We, going back to school, we're still waiting to see what all of the schools are going to do and how that's going to be. And it's really an individual choice based on your health needs, based on any underlying medical conditions that you have that put you at higher risk. But, your comfort level in that. But for the majority of people, I mean, we do think that, your teachers kind of fall into the category of nurses. You're kind of our everyday heroes. You work with people side by side in close comfort. And I think that's really important. I also would defer to the blog post that Dr. Beckman put up today on Family First and on our page that really describes a pretty comprehensive approach to reviewing coronavirus and going back to school as well.
Yeah.
Mm-hmm.
So, discussion just yesterday and how people are approaching this and how educators are approaching this and what the schools are doing in different areas too as well. So just stay in contact with your child's school and how they're handling things and being abreast to what the requirements are, and also staying safe and continuing to be vigilant is most important.
Last coronavirus question for right now, at least, is would recommend waiting to try to have a baby coronavirus program. I would still say again, if you what's for you, what is your comfort level.
What the science is really telling us that there's very limited risk of vertical transmission out of all the worldwide cases of coronavirus that have been reported and all the pregnant women that have been studied. Right now, there's in the literature and reported one case.
Meaning the mom has to do it.
Right, that's it.
And everybody.
One worldwide, one. So based on that, I would say, if now is the right time for your family to have a baby, then now is the right time for your family to have a baby, and don't be afraid to, try. And for some people now might be a better time because they're not going to be working and running downtown or running to an office and gone long days and commuting. They can work from
home, and there's more options for some things like that. So for some people, that may be a better option. For other people, we obviously understand that this time is financially stressful, and there are things that are going on like that that make it not a good time to have a baby. But wherever you're at, we're here to kind of help support you throughout that and meet your needs, whether that is a pre-pregnancy planning visit so that we can talk about your health concerns and timing of pregnancy, or whether that is a pregnancy prevention visit. We can meet both of those needs, and those are things that if you can't come into the office, we can also accomplish most of that through a telehealth visit. So once again, feel free to give us a call and schedule one of those.
So the next non-COVID question. Right. Maybe I'll read the question and the rest.
Why don't you read who's asking?
Okay.
Who's asking?
So there's like two parts to this question. Let's see. Who asked this question?
Okay.
Oh, Tina asked, do all of your patients rotate through all the midwives? And then B, Ariana asked, do you attend the births of all your patients? I think those kind of fall into me, so kind of
Yes.
Sean, you want to answer?
Sure. So we highly recommend that you rotate through everybody. Oh my gosh, cute baby.
So cute.
We highly recommend that you rotate through all of us, and that includes the doctors as well. We want you to meet us, we want you to meet doctors. It builds a level of comfort when you can see our faces and you talk to us, and you get to know our personalities a little bit. And we're all different, right? We all practice differently, the same but different. So we do want you to see all of us if it's possible. And we know that you're going to probably get comfortable with one or more of us, but at the same time, it's really good to get to know all of us. And then as far as delivery goes, we do work on a rotating schedule. So we may try as hard as we can to accommodate you if you do have requests, but really we base it on how our schedule is working out. And we do have a pretty regular schedule. So, if we would go so far as to say that there had to be an induction for whatever reason, whether you wanted one or whether you needed one, we can try to plan it out according to what you need or what you want. So we try to accommodate as much as we possibly can.
Midwives see all, deliver all the midwife patients.
Yes.
But sorry, there are definitely patients that we see. Lucille, hi. She said Dr. Slovaki delivered a baby about a month ago. It was a C-section, but we saw Lucille throughout her prenatal care. So we also saw her after she delivered her baby. So maybe she wasn't our patient, but she was still a patient that we saw in the practice, and we love seeing her and we look forward to continuing to see her. And so, we deliver all of our midwife patients, but there are other patients that we see too.
Right. And we want to see the doc patients too, because you might need breastfeeding care, or you might have help or questions about other things that we can help you with. So
And we're a collaborative team. We work with them, they work with us. There are some patients that definitely are high risk and require a physician for some parts of their care. But at that same point in time, we can definitely do a lot of education with you, answer a lot of questions, and collaboratively manage those conditions with our physicians.
I think what's also nice, as you said, we're a collaborative team. So going back to the practice that may not have midwives or physicians in their office, I know where I delivered my daughter, if the doctor got called out for delivery, guess what? Office got canceled, so we have to schedule an appointment. So what's nice with us being all together, we got a patient with Dr. Sadaki, she got called out for delivery, but guess what? Tiffany or Jackie or Beth's here, you can see her. You pick up, you see one of the other members of the team. So that's a part that's nice. Your continuity of care continues. And that's a good thing to have, so you don't always have to get canceled and get rescheduled because a baby does not have baker's hours and they don't know when to come.
That's
They
a
don't know
classic
her.
to
They
be
have.
line.
Oh,
Babies do not have baker's hours.
they don't.
another
Not at
t-shirt.
all.
So you're saying I should have become a baker.
Well, you would have great hours. You're not up at like 3 o'clock in the morning. Right? Baker's hours, but definitely interrupt office hours, that's for sure. So no vaginal question. So.
No vaginal question.
No vaginitis.
No vaginitis.
And no PPD. The snuggles. Wouldn't be the same.
Another question, a little bit going back to coronavirus, someone did ask, Ariane had asked what things have changed. I just want to mention that partners can come into the office and one person is always allowed at the hospital for the birth. I'm pretty sure it's always the same person, but maybe there have been instances where one person was at the birth and then another person was there the next day. But I don't think that's a
I don't
standard.
think
that's
that's
not
not standard.
standard.
That's changed.
Yeah.
It's been pretty much
It's just one person and a certified doula can attend your birth.
Right. And that's a change, which for a long time they were not letting doulas
doulas.
in. And now they're definitely letting doulas in at all of the hospitals that we're in staff at, which is great.
And we let a partner come in because I know Teresa recently transferred to us and said that at her 20-week ultrasound, her husband couldn't be there, but she was seen before. So that was a bummer. And I know my cousin's wife, she went to get an ultrasound and couldn't even FaceTime or video. So if your partner, gosh forbid, can't be here, we are willing to let you FaceTime your partner so that they can be here. I recently had a visit with a patient and she FaceTimed her mom because she couldn't be here for the entire visit. So
And we've done a lot of different settings.
no, more than
We've
happy
done
to do that.
deliveries too, where like, you know, patient wants mom or her sister or
Yeah.
mother-in-law
Mhm.
there. And we've done it where like husband's there or partner or whoever is there, your support person is there. But we also have a live stream going on where other people are there rooting you on, being supportive of you. You know, we want to make it as least Rona as we possibly can.
But not to be confused with recording of the actual birth. A lot of people get that confused. It's not our policy, but that is the hospital's policy as well. So just please don't confuse the two things. So just be aware and clear about that. But if you want to support everybody, then they have the support that they desire at their birth. And if their experience is close to what it would normally be, and Rona wouldn't ruin it.
Right. And we are definitely making sure that if you want a doula, we would connect you with a doula who is able to be there with you in the hospital and be physically present to help you through that process. Especially a lot of our VBAC patients are wanting to do that. And I think that's the only other thing which I know Jackie covered a little bit earlier. Our VBAC and injection patients are being screened for corona in the office prior to their scheduled procedure. That's about the two big things.
That was a perfect segue into our next question.
Awesome.
We'll let you
It's
answer
like
that.
I knew.
Jelena, I think is the name, is a common practice to induce at 39 weeks for AMA. Do you do this or do you wait until 40 weeks?
So again, I think that a lot of our care is not protocol driven. Obviously, we follow ACOG and ACNM's guidelines, but it is individualized care. So there is not a hard and fast rule that we induce you at 39 weeks or at 40 weeks. We do let patients go past their due date. We start doing antenatal testing for our patients, and we would make sure that mom and baby are both doing well, that we're talking about any risk factors that would indicate that you would need to be induced, but that would be a medical induction or for a social reason if the mom needed a particular day. And it would be based upon whether that particular patient needed it, not something that's just, oh, you're this, so we do this. And it's a discussion and it's a decision that we make together based on your individual needs.
Not a one size fits all. So, and there's definitely some collaboration with the physician. So that's another nice thing that, you know, in another practice, you might have had to transfer to a physician, transfer to another hospital. Whereas with us, you could still remain in the same practice, but you collaboratively. Hi, Edith. She's excited to be so
Oh, stop
Tiffany
it.
is getting all the call outs.
Super popular
Oh,
tonight.
Tiffany, I think, is also the number one, like, doesn't meet people in the office and then delivers their baby.
Yes,
And
it's
they
very true.
love her.
She steals all her babies.
Just to know, if you don't meet someone, you're so
Wow. That's a good thing.
The universe seems to always provide the right energy for that person. I think that's
a famous line that I stole from my preceptor from years ago. The baby calls, the baby today. So I guess I can call
putting
it.
I love that. I love that. One other question that we had from Robin about we do accept late transfers. So anybody who is not currently happy with their provider or the guidelines that the hospital that they be delivering at, there's a lot of opportunity for you to
No, there's not a cutoff. Last week we actually were talking with a mom who wanted to transfer, and she was almost 39 weeks, like 2 days shy of 39 weeks. So, right. And
I had one that was 39 weeks, and I delivered her 2 days later.
yeah, we've had that, and we had a mom who came in for a VBAC with us, literally the week that she was having her baby. So it's never too late to transfer in, and that brings up, as a group and as a practice, we definitely support VBAC. Our VBACs are all delivered at either Silver Cross or at South Suburban. We do not do VBACs at Christ. But we do manage VBACs collaboratively with our physicians. We definitely put safety nets in place to make sure that we have your records and we talk through and set you appropriately about a VBAC. But we are definitely doing vaginal trials of labor. We also have, I don't know how many subjects this week, but I
The
think
twins went back.
the twins, I think Monday was twin day, and I think that we saw about 5 sets of twins. So
Oh, gosh.
yes, we do manage twins. Again, we collaboratively manage twins with our physicians. And yes, twins can deliver at hospitals that we deliver at. They don't all have to deliver at Christ. So
And they can deliver vaginally.
And
yes,
that
and-
actually helped deliver my twins.
and yes, they can deliver with a midwife. And then they can come back
Crazy.
and
And it won't be in a field.
With shoes.
mind blowing. And Shauna has these magical pillows that she can bring out and show twin moms how to breastfeed twins and all of that, both simultaneously and individually. So, we're all about the twin thing. It's really kind of fun. And we're all about the VBACs and meeting your needs. So, anything else?
Another question, maybe a little more personal, so maybe I won't give all of the details, but a little bit going back to coronavirus. Someone asked that they have a higher risk factor. Maybe they have diabetes or high blood pressure, and this is a scary time to try. So should I try during this time? I think, again, you have to do what is best for you. You already are going to be a higher risk pregnancy, and maybe you do have to just be more cautious during this time. You probably don't get to see all of your family and friends. If there's a party going on, a baby shower, or graduation, you get to sit that out. If you're already higher risk with one of those factors, you probably shouldn't be seeing a ton of people in general. So if you're also pregnant, kind of same thing. But again, we take care of all patients of every with all issues, I suppose, low risk and high risk. And again, we haven't had a lot of positive news. So
Great questions.
awesome question.
Don't be shy, you guys. Bring it in. Bring on those questions. We're happy to answer anything.
And if you have more questions about a midwife and you don't really know how you feel about a midwife, you can always just make one of your appointments with us. If you're planning to deliver with the doctor at Christ, or you see one of the nurse practitioners where you're like, oh, this is kind of interesting. Maybe you want them to meet with me and ask her some questions and see what she has to say. Yes, you could transfer your care. You could be 30 weeks. So, midwife. That's okay.
I'm trying to think of like some of the things that people kind of ask when they're visits or what's common. I guess touch base on visitation at the hospital and what that looks like in partners and things of that nature. Returning to school. Another, I think, as patients get older and then just visits to the office, we definitely see annually coming to speak about
Yes.
this. And I think that's really great.
How many times have you heard, I'm too old for that?
Yeah.
I don't
Right.
want to see a midwife.
Yeah.
That
Yes.
is close.
All the
We are
time.
not having more babies.
Yeah. Right. They hear midwife maybe with childbirth versus I think that touched on that a little bit, but I just think to bring that home again, just to know that we take care of women across the lifespan. So that includes your well-woman visit, that includes family planning or teen education about pregnancy prevention and all of that stuff. So it's really, really important to much we can do as advanced practice nurses and as certified nurses, which is under that same umbrella as an advanced practice nurse.
I think I've seen young girls as young as like 12 years old, and it's not uncommon for me to see women who are in their 80s. And we also have specialists. So I think that one of the things that we forget again, and part of being a collaborative practice, is that we also have a urogynecologist as part of our practice. Sorry, Shauna's getting a call from, and she is the midwife on call. She's a midwife. But we do have Dr. Finkelstein, who started the practice, and he is a urogynecologist. So that means that he can work with women. He is one of the most skilled robotic surgeons in the area. So he's about to perform his 1,000th robotic hysterectomy, which is way more than most surgeons are doing. He does a lot of bladder surgeries, a lot of.
It is not normal to do it.
Yes. It's not normal to have pain during sex either. So there's a lot of different things that we can tackle and talk about besides pregnancy, and that's really a key. That's midwives do a lot more.
Yeah, we do.
I think another kind of side note to that, great topic I'm talking about that we can see at all times, is that we have Family First Medical Group here at FFMG, and so we also encourage our patients and families to see them. So I will tell my patients, you need to bring in your partner, female or male, to come and see them. Maybe they don't go and see anybody for care. Many women only see OBGYNs or midwives and don't see primary care doctors or nurse practitioners. How many of us do that? I'm guilty of that. I have forward and work to my midwife. So, along with that, when your child ages out of their pediatrician, they could transfer to family first medical group. If you have a baby and you need a pediatrician, they could start with family first medical group. If you're a patient of ours and has high blood pressure, and my famous question is, do you have a primary care doctor? Do you like your primary care doctor? So if you have
Is your primary care doctor on staff where you're planning on delivering?
right, yeah. So if you want to, continue care here, the great thing about that is that we can see each other's notes. So maybe I send somebody to Anne to check in on someone's blood pressure, and then I can see that note. And maybe that patient becomes pregnant later, and you can see what Anne had to say about that. So we can also collaborate here in terms of that. Or if you develop high blood pressure in pregnancy, but now you don't know who to see afterwards, another great subject.
Or gestational diabetes, then it doesn't resolve when pregnancy is over and you become a diabetic. That's somebody that can follow the family first as well, and continue your care. So there's a lot of different things that we work back and forth with to make sure that everybody is maintaining the care that they need. We also do vaccines if there are vaccines that we need, and Family First Medical Group can take care of vaccines that your partner may need for having a newborn in the house or for travel or work or other things like that. So there's a very collaborative environment and feel to what's going on in our office space.
I think another topic to touch base on is population of patients. I get asked this sometimes, is our office gender friendly for the LGBTQ community? And I definitely say that we are. So sometimes that's a sensitive topic for some people, just to feel safe and to know that you're able to speak freely, you're able to feel open and welcome. We definitely are. So.
And this is also, and I think that's a great segue. This is also a very safe, welcoming environment for all races, all nationalities. We have bilingual providers, we have bilingual staff. So if English is not where you're most comfortable, we can make sure that your visits are translated. We have had patients who have other either issues with handicaps and issues with hearing or with speech or sight, and we have ways that we can work with them and translate for them as well. It's also a safe
providers for religious reasons.
yes, or patients who have had any kind of abuse or trauma or domestic violence, where whole idea of coming in for an exam can be very traumatic. This is a very safe, welcoming space where you can spend time, get to know a provider, and then determine if an exam is even needed, and if so, what exam is needed, and those exams are performed with your permission, and people are guided through them. So again, it's a very, very safe space. One of the other things, speaking about our LGBTQ community, we also have worked with our reproductive endocrinology team, and so we do have many same-sex couples who come in and deliver with us, and surrogates, and we have a whole variety of care that we can provide for the community that we're very supportive of that. We are here to help women meet their health goals and their needs and their family situations wherever that is.
Awesome. A couple more questions in terms of children. So one is, what are our thoughts for newborns waiting for friends? I guess for me, I would say again, comfort level. What is that family do? What is their risk factors? Are you going to bring it to them? Are they going to bring it to you? And then are they willing to maybe visit outside, but you don't help them?
So how I was educating patients, this is well before we got to phase 4, and just not letting family members feel left out and being a part of you transitioning after you first had your baby, and so they feel, like I said, a part of the village, right? So it takes a village to raise a child. That's how I grew up. Maybe have somebody make a casserole or something, or drop off the laundry and they can bring it by, or the person who is helping, if it's your sister or cousin or something like that, and let you sleep for a couple of hours, and then they can come over and watch the baby after of course, give that time to, if you have, the person's been tested and you want them to come over, then that's even better. But just to not necessarily have it be, 20 people coming over because they're super excited about seeing the baby, I would probably be a little reluctant about something like that. But definitely,
yeah. Mm-hmm. Don't do it all yourself.
Right, exactly. So, but at least, taking it in baby steps and just allowing, some help so it's not so stressful for the new mom trying to do it all by herself because she doesn't want anybody helping. But at the same time, small amounts of people coming over, just minimizing the amount, but at least taking the edge off so we're trying to wash the dishes and wash the clothes and take care of the baby.
Right.
And as you and make food and doing too much after you just had a baby, you're calling us saying, my bleeding just increasing. I know why.
Yeah,
because you're doing too much.
More than ever, it's hard to be your own advocate, you can be weird about stuff. You can say, no, I really don't want you to come over and hold my baby, but you know what? Could you, wash my dishes? Or could you bring me a meal? If I give you a grocery list,
do you want to buy the grocery store so I don't have to go out into the room? It's not that
Can I
I
meet you outside for a walk and you wear a mask? Okay, if people want to come and see you, they want to come and see you.
They will. I promise you.
And just make sure they're washing their hands. That they don't need to be hugging and kissing the baby if that's
and even before Corona, they shouldn't have been doing that anyway.
So they can wear a mask in the house if there's a reason. Wash their hands, stay at a distance. All of the same practices that we're doing otherwise.
Right. Last question here. We are wondering any recommendations for students heading to college this fall, and I guess I would piggyback on that with saying also kids going to school in general. We talk about vaccines. We don't want people to miss out on vaccines. We definitely get those well-child visits in, physicals, do that to school, but then
feel free, anybody who needs a college-bound physical, we're still doing those. Those are a great opportunity to come in, meet with one of us, have a lot of education. We talk about everything from campus safety to what happens if you are a victim of abuse or sexual assault on campus. We talk about birth control, menstrual cycles. We talk about, all kinds of just general health things. We give you our cell phone number, program the office number in, so you have a 24-hour-a-day person that you can make a phone call to. We talk about medications that you may need. We talk about all of themselves safe and healthy, what that actually looks like, what the benefits of wearing a mask and that are. And we'll talk about mental health, how to keep yourself healthy in this time frame. You know, how to prevent going away to school is stressful. So talking about, you know, what that actually looks like, when you reach out for help, what resources there are. And we'll be a resource for each student and another person that they can outside use of, but besides yourself. We, as far as like an actual opinion about students going back to school or online schooling in that college population, you know, again, we're kind of taking our information as it comes in and developing our thoughts and policies. But again, it's really individualized what you have to do, what you and your student are comfortable with, what that distance looks like, what the campus's policies are. Some campuses are limiting numbers of students, dorms are different. So I can't really give you a hard and fast answer as to what we think that will look like, but we're more than happy to support you and support your student.
Nana, you heard that? I think
All right.
that's it. So,
So,
I'm gonna give you a little bit of a
We're
tour.
going to give you a tour of the new office. Yay! We're so excited by it. So we're going to unplug. Sorry if it's bouncy for a few minutes, but we're going to take you on a tour. And I'm going to turn it over to Jackie.
I'm the tour guru, apparently. Even though I kind of get lost in here quite a bit lately. So,
Yeah.
and I don't have a selfie stick because a lot of people think that I do. So let me just clarify that.
You should have a selfie stick.
I don't.
Which way are you going?
I should have longer arms because Tiffany probably has way longer arms than
I'm
me.
taller, that's for sure.
All right, so let's say we come off the elevator here, and we're on the 7th floor.
Yes.
So we come to the 7th floor, and we're gonna make a right, and we're gonna
Walk
go this way.
backwards. Can you walk backwards? Yes,
I
you
might-
can.
I might run into something. But
Welcome.
So here we are. One of our wonderful secretaries, Panda, here
Yes, from Panda. See her mask, she's got
on the
pandas.
spot. All right, and there's the waiting room. I have to take you over here to this wonderful view. I'm probably going to run into something, but that's okay. Yeah, right? We still call it the Sears Tower. So if you
Oh, yeah, I know.
don't, then we're sorry for you.
It's way back there, but you can see
Oh, there we go.
Which
Got
way
it.
would you like to go after this? Do you want to go to ultrasound?
Sure, let's do that. So when you're in the office here, there's kind of two sides. There's some beverage station in the middle, but there is the left and the right side. So if you came to the right, you would be going to ultrasound. Or if you had to get non-stress tests, that would also be over here. So here we are for ultrasound. There we are. So kind of like the Mokina setup where they're individualized rooms, a bed, plenty of room for your guest. Doesn't always have to be your partner. Sometimes patients' moms come with them or sister. There's a couple more ultrasound rooms. Here is the non-stress test room. So non-stress testing.
Again, beautiful views while you're taking your non-stress test.
So you can get a pap smear with the window open because we're on the 7th floor. Not so much in Mokina.
We have this lovely conference room. As
Oh,
you can
look,
see,
We found Shauna.
Shauna's still on the phone with the hospital, but we have a lovely conference room that we can use for prenatal classes and teaching as we can.
All right. And I think we're going back that way, right?
Sure, we can.
We all coordinated very well.
We did.
Beth told us what to wear. Don't worry. This is like a giant selfie stick. I'm literally walking around with a laptop in case anyone didn't know that. So, oh, the lab. Kind of a long hallway like in the Mokina office. Same thing here, consult room. So if you wanted to come in and meet and greet, maybe not have an official visit, which we do. We usually talk about that.
Yep.
That we do. We do that too, though. Everybody poops. Duh.
Lovely bathrooms.
It's so pretty. Purple's my favorite color, by the way.
Actually, you know what my tagline is? Is that I tell patients, you know the book Everybody Poops? I'm going to write the book that's called Everybody Has Vaginal Discharge. Because nobody thinks they do. Long desk here. And there's another long desk if we keep walking down that way. But look at all this wonderful artwork we have.
It's so pretty.
Courtesy of Dr. Finkelstein's wife. Shout out to her. There is so much cool artwork. Oh, look at that.
It's so cute.
And then let's say we want to check out what shopping we can do after our visit.
You can come in and see a room.
And then here's a room. So also similar to the Mokina office.